Ladies and gents, it's time to get involved in something absolutely massive, huge. I want to welcome back to the show, no stranger, Dr. Liana Roodt. Good morning, Doc.
Good morning, guys.
Hi.
Now, Dr. Liana Roodt is the most selfless doctor you'll ever meet, founder, director, and hands-on surgeon at Project Flamingo. Now, let's just inform everybody again what Project Flamingo is, Doc.
Well, Darren, so I think the shortest way of saying it is that we are doing what we call catch-up surgery lists for our patients in the public healthcare sector, and that requires cancer surgeries, particularly breast cancer surgeries, because we all know that there's a terribly long waiting list for those operations. And with Project Flamingo, we are trying to shorten that waiting time by operating on these patients.
Yes, so obviously October was Breast Cancer Awareness Month.
Yes.
Well, still is. We are still in October. But it shouldn't just be a monthly thing. This is something that happens all year round. Now, so just to sort of elaborate even more, so, I mean, what are the breast cancer is something that is just, I mean, you see, get yourself checked. Early detection is the key. And sure, it is rife.
And it has devastated many families.
It has. And the thing is, as you say, there are, in the public system, that can only do so many. Then there are the ones that you have to wait. And as we all know, with cancer, waiting is the worst possible thing you can possibly do.
Yes, absolutely. So wearing the pink ribbon and being aware of breast cancer is great, but then we need to be able to manage it and we need to be able to get people to treatment. So that's super important, and that was our focus this October.
So, Doc, from sort of diagnosis and a doctor saying to you, we need to operate.
Yes.
And normally you'll hear we need to operate tomorrow, you know?
Yes.
How much worse can something like breast cancer be if you leave it a month, 2, 3 months, 4 months, 5 months, 6 months before you operate?
Yeah, Darren, so I think there's layers to the impact that it has. So fortunately with breast cancer, we have a little bit of time. So breast cancer tend to not be that fast growing. So if you look at the international guidelines, they usually say from diagnosis to your first intervention, 6 weeks is the absolute maximum that you can wait. So unfortunately, our waiting times have been much longer than that. So after 6 weeks, you can get progression of the disease, and this can be very subtle. So that's the one thing. And then secondly, that should not be underestimated, is the terrible, terrible psychological impact this wait has on the patient, as well as the patient's family and immediate community.
Of course. Okay, so currently in the queue at the moment, what numbers are we looking at?
So, Darren, I think Project Flamingo is operational in the Western and the Eastern Cape. And in the Western Cape, after a lot of work after post-COVID, at Roodt, our waiting times are sitting at about 6 to 8 weeks, depending. So that's actually great. It's far from perfect, but for us, that's a huge achievement coming from 16, 17 weeks waiting time. But in the Eastern Cape, the situation is much more dire. And like last year, every single breast cancer operation that was done at Livingston Hospital was actually on the Project Flamingo list. There was no other theatre space. So there's a lot of work.
And let me just tell you what Project Flamingo is. So Doc Roodt and her colleagues, we're talking anaesthetists, we're talking all that, they literally spend their weekends while we are out watching rugby matches, watching Premier League football, out at Kirstenbosch, in the garden, sipping wine. Doc Roodt is in the operating theatre with all her wonderful colleagues, doing these operations, playing catch-up with vital time.
Dr. Liana Roodt, thank you so much to you and your incredible team. You've been doing this great work since 2010. Please tell me there are some success stories.
There are amazing success stories. I think starting in 2010, we all hoped that come 2022, there would be no more need for Project Flamingo, but unfortunately the need is bigger than ever. But in this 12 years, the beautiful stories of our patients and our survivors has really kept us inspired and going. It's been incredible. And like I say, for us at the moment, post-COVID, where we thought we would be like in absolute dire straits, the waiting time here in Cape Town is actually looking up. So, yes, there is a lot to be grateful for.
And did I tell you that Dr. Roodt and her colleagues, they don't even charge for this stuff on weekends? They do this all for free.
That's why we raise funds.
They do this all for free.
How many surgeries are you able to get through in a month on average?
Well, what does Saturday look like for you?
It really depends on the type of operation that we do for the patient. So a tumor excision is a much shorter operation than, say, a bilateral mastectomy and reconstruction. So it really varies, but on average, we try to do not less than 4 patients. So it's usually between 4 and 6 patients. Sometimes we actually can pay enough nursing staff so that we can open 2 theatres, and then we'll do 10 patients. So in 2 weeks' time in East London, we've got 10 patients on the list. So, yeah.
And this is over a weekend?
Yeah, that's usually on a Saturday, yes.
Okay, so now, so there will be, the forecast is 200 that will be outstanding operations that are required. And the hard cost per operation is 6,000 Rand, which is literally
it's nothing.
all that stuff that you guys that you use, you know.
Yes, exactly. So if you think that all the surgeons and all the anaesthetists and all the assistants, they all donate their time and their skill, and our biggest cost is paying for our nursing staff, because they are essential in doing this work, and then trying to get donations for our consumables that we need in theatre, and sometimes we have to pay that as well. So then the cost would go up, but on average, that's what we try and spend per patient.
Okay, so it's just doing the quick maths here. 200 times 6,000, we've got a total of 1.2 million. Tring, 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 tring. Where's my good friend, Director of Lotto Star and the Star Foundation, Tasoulla Hurwitz here. Good morning, Taz.
All right, Taz.
Morning, Darren. Morning, Dr. Roodt. Morning, team.
Morning, guys.
Okay, Taz.
Yes.
Let's do something together, yeah.
I love doing things with you, Darren, and team. So Darren and I, we've been speaking, and we wanted to take on a project for the next year that means a lot to us. And means a lot to every family. As we've discussed, we all have a mom, we all have a sister, we all have, someone in our lives that could be affected or is affected by this. And Dr. Roodt, thank you, because without you, I think a lot of families wouldn't be in the position they are to celebrate a birthday or a New Year's or a Christmas or anything. So what Darren and I were discussing was we would like to take on your surgeries for the next year, 200, the 20 a month. I think it comes to 20 a month, and help you get through your backlog as well. Project Flamingo is very close to our hearts. I think, Darren, we did one in May, in May 2021.
That's right, yes, yeah.
As well. And we would love to assist with KFM, So we would like to take on this project for the next year.
That sounds unbelievable, guys. I can't believe my ears.
So Doc, you can stop with the fundraising, although it always helps. Yeah. It always helps. No. There's never enough.
No. Collect money.
Now we can do more. Now we can do even more.
We have more capacity.
That's unbelievable.
Okay. So I want to check in with you every month and just see how it's going, where we at, if there's any further requirements, any further needs, whatever we can help with, we are here. Project Flamingo, we are holding your hand through this whole thing.
Guys, I am speechless. I think I'm going to cry a little bit. This is insane. Thank you so much.
Okay.
on behalf of the team and most importantly, our patients.
Yeah. And this is and we extend this. This is not just the Western Cape. This is also the Eastern Cape here.
Yes, very importantly, the Eastern Cape too.
Okay. Doc, we'll speak to you in about 30 days and see where we're at.
I look forward to speaking to you guys and giving you good news of all our patients benefiting from this tremendous generosity. Thank you so much.
It's a pleasure, Doc. Good work. Great work. Round of applause to
Go
you.
well.
Round of applause
Love
to
to
you.
your team.
And Tasoulla at Lotto Star, well, it's just never a question with anything that we ask for.
No, you've got to give back. If you don't give back, it's paying it forward, guys. It's 100% paying it forward. And you never know when we're going to need Dr. Roodt somewhere down the line.
Yeah. Yeah.
So, and it's amazing people give up their weekends. I mean, I'm the most laziest person over the weekend. All I want to do is be with my kids and, take a nap in the afternoon.
Yeah.
And it's amazing other people are actually giving back all their weekends and all their time.
No,
And the nurses and everyone. It's,
it makes us feel very guilty, doesn't it?
Yeah, no, 100% guilty.
Thank you very much, Taz.
Thank you, and thank you, team, for joining us on this. Much appreciated.
It's our pleasure. Lotto Star, Project Flamingo, and KFM Mornings. Oh, man, let's do this. Let's get it done.